Hello everyone. So today I'm going to be talking about venous insufficiency. So basically this is when the veins in your legs are unable to efficiently return blood back to the heart. Now, if they're unable to return blood back to the heart, this is often due to malfunction of venous valves, of course, which leads to pooling in the legs. So really it's unable to go to the heart. All of that will cause venous pressure and subsequent vein dilation, inflammation, and tissue damage because it's unable to move really back to the heart. And a cause is varicose veins. So now here, varicose veins, I go more into detail. These are basically what we call spider leg veins. They're mainly on women more than men, and they basically really cause ankles to swell, some leg cramps at night. Our patients may experience some pain noted earlier in the day, but the veins are bluish purple. They're a little bit hard to touch when you rub the skin. Risk factors include weakness in vessel wall or valves due to prolonged pressure. So all that pressure will definitely cause weakness, or if you've been doing something like heavy lifting, prolonged sitting or standing. Now, if you have a job where you stand and there's no stool, you may get a varicose vein or a DVT, which we'll get into later. Some hemorrhoids as well. Here I have a lot of some treatment types and interventions, which include elevation, stockings, compression stockings, just regular exercise, making sure that you're educating the patient on what these really are. And when I mention elevation of the legs and compression, keep in mind that this is varicose veins, right? And it is a cause of venous insufficiency. So earlier, I made a video on arterial insufficiency. So arterial insufficiency, no elevation, no compression. But venous insufficiency, V, you do want to elevate and you do want to have that compression. Why? Because the blood is unable to return back to the heart. So when we elevate, all that blood goes into your heart. Anyways, another cause is deep vein thrombosis, also known as a DVT. Here I go more into detail what a DVT really is, and this is immobility, trauma, genetics, can be caused by lifestyle, like standing too much or for prolonged periods of time, oral contraceptives, smoking, and hypercoagulation. So that's excessive blood clotting. So when you think of a DVT, this is a partial occlusion or complete occlusion of a vein by a thrombus, which is also known as a clot, with secondary degree inflammatory reaction in the wall of the vein. So there are acute DVTs. These are in the lower extremity, happens in the lower extremity. They feel a lot of pain in the posterior calf. Now, what does this mean? Homensign. Homensign is pain in calf when the ankle is dorsiflexed passively. So you're going to passively dorsiflex and then you're going to feel pain in the calf. You might have a DVT, but allow your physical therapist to do that. Do not conclude that you have a DVT without knowing if you actually do. The diagnosis is a Doppler ultrasound. So make sure that it is accurate if you are experiencing any symptom of that sort, because you do have edema, you do have tenderness, you do have warmth of the skin, but you want to confirm. So of course, for treatment, early mobilization, compression. Do you see how it all connects together? The DVT, the varicose veins, the venous insufficiency, loose compression is back in again, these compression stockings, ambulation, bed rest until anticoagulated. So we'll get into more within the medications. However, I just want you to know the main things that you want to know within an anticoagulant is heparin and Coumadin. We're going to get into a little bit more into detail later in the video. However, keep in mind that there is always a connection. I want you to connect venous insufficiency, varicose veins, and deep vein thrombosis, all having some sort of relation to one another. Other causes are aging, reduced mobility. How many times have I mentioned you need to do mobility as an intervention? Comment down below how much you believe I have said mobility. Anyways, obesity and pregnancy. So signs and symptoms, we do have the edema, swelling, pain, leg cramps, the veins, of course. The skin changes. How the statistics mainly for venous insufficiency as a whole affects 1 in 20 adults, with the risk increasing with age. We went more into it. Of course, it still remains that women are at a higher risk. And when it comes to vitals and spirometry, heart rate and blood pressure are important to assess overall. Spirometry is not typically used in the diagnosis or management of venous insufficiency. Spirometry is more relevant for respiratory conditions like asthma, which or COPD, which I have a link in the description down below. I made a video on COPD and everything you need to know about it. So basically, a DVT is the formation of a clot in a deep vein, usually in the legs. Venous insufficiency is where the veins have trouble sending blood from the legs back to the heart. So I just wanted to refresh on that. The DVT is a blood clot. The venous insufficiency is just that inability for the veins to return back to the heart. So just a little refresher, this does determine medications. First medication is an anticoagulant, and that is your warfarin, heparin, Coumadin. These prevent the blood clot. So what would you use this most in? It would be a DVT, right? Venous insufficiency, there's a connection, of course, compression, stockings, lifestyle changes. Of course, we need to keep increasing that mobility. We need to avoid prolonged sitting or standing. The weight management is also a big one. Some dietary changes as well can help. So there's surgical options too. As we've seen in the DVT, there's lasers. However, for venous insufficiency, you can do vein stripping, sclerotherapy, and vein bypass surgery in severe cases. I do want to mention too, as I mentioned, venous insufficiency, elevation of the legs. So when you have venous insufficiency, a physical therapist would most likely have you in supine. In terms of exercises, leg lifts are a great way to really improve the blood flow and to straighten your leg muscles, because remember, a symptom is weakness. Ankle pumps while sitting or lying down, you would basically promote blood flow to your legs, from your legs back to your heart. Calf raises, swimming, cycling. And if you are looking for very specific interventions, feel free to rewind on the video and take a look at the charts based on whether it's a DVT or a varicose vein. It's very specific, but this is a general overview of venous insufficiency and the causes. And comment down below if you have any questions.